This video we are going to discuss about the cholinergic drugs. Before that, we should have an idea about the parasympathetic nervous system and the neurotransmitter and its receptor on which it is acting. So we'll discuss about that now, and we'll go into the cholinergic drugs. So we are going to discuss about the parasympathetic nervous system. So from the parasympathetic nervous system, we know that the neurotransmitter which is released from the parasympathetic nervous system is the acetylcholine. So acetylcholine is the neurotransmitter which is present in the parasympathetic nervous system. And acetylcholine is secreted by the preganglionic as well as the postganglionic fibers. So it is secreted both by the preganglionic and postganglionic fibers. So briefly discussing about the metabolism. Okay. So acetylcholine is synthesized mainly from the acetyl-CoA as well as the choline. So this is a neuron. First of all, the neuron has to uptake the choline. So this is the choline uptake. So choline uptake is actually the rate limiting step in the synthesis of acetylcholine. In the biosynthesis of this neurotransmitter, the choline uptake is the rate limiting step. So acetyl-CoA plus choline combines together to form the acetylcholine, ACH. So now this choline uptake is inhibited by a drug which is known as, this is inhibited by hemicholine. We will discuss about it later. This is hemicholine that inhibits the choline uptake. So this acetylcholine, after being synthesized, it is taken into the vesicle. So that is known as the vesicular uptake. So vesicular uptake is also inhibited by a drug which is known as vasamicol. So vasamicol. So and this so when an impulse is reaching the neuron starts releasing the acetylcholine by the process of exocytosis. Okay, so by process of exocytosis in the synaptic cleft, the acetylcholine is being released. Now the released acetylcholine will act on the preganglionic as well as the postganglionic receptors and produce a response. Now you should know that the acetylcholine is being broken down or metabolized into choline plus acetate by an enzyme which is known as acetylcholine esterase enzyme. So acetylcholine esterase enzyme is breaking down the acetylcholine into the choline and acetate. So if you are using acetylcholine esterase inhibitors, there won't be breaking down of acetylcholine. So more of acetylcholine will be there in the synaptic cleft and more of cholinergic activity will be there. So to increase the cholinergic activity, we can use the anticholinesterase drugs or cholinesterase inhibitor. So cholinesterase inhibitors are used to increase the effect of acetylcholine by decreasing its metabolism into choline and acetate. Acetate. So that is brief about the metabolism of acetylcholine. So our topic is the cholinergic drugs. So we should discuss about the action of acetylcholine and its receptors. Okay, we are going into that. So cholinergic receptors can be divided into nicotinic receptors and also the muscarinic receptor. So okay, nicotinic and also the muscarinic receptor. So muscarinic is also being divided into NM type and NN type. So NM stands for neuromuscular junction. So these are present in the neuromuscular junction, and NN type of receptors are present in the ganglia and also adrenal medulla. So and muscarinic are of 5 types. So there are 5 types of muscarinic receptors. There are M1, there is M2, and there is M3 and M4 and M5. So 5 types of muscarinic receptors are there. So first look at the M1 type of receptors. So M1, the main region where it is present is the gastric region. So it is present in the gastric region, M1 type of receptors. And if you see the M2, this is mainly present in heart. So heart is the region where M2 type of receptor is present. So heart. So M3 is present in various organs. So which are the organs in which M3 is present? First of all, it is present in the eye. So it is present in the eye. It is also present in the GIT. Okay, smooth muscles. Then it is also present in the bladder. So this is the bladder. And it is also present in the bronchus. Okay, this is also present in the bronchus. And other one is, it is also present in the glands. Okay, these are the important regions where M3 receptors are present. And about the M4 and M5, you should say that all these receptors are present in the CNS. So CNS, M1 is present in the CNS, M2 is present in CNS, M3 is present in CNS, M4 and M5 are present in CNS only. Now we will see the effect of the acetylcholine in all this system. So you should see that M1 is present in gastric, especially gastric glands. Okay, and M2 is present in the heart, M3 is present in eye, gastrointestinal tract, the bladder, bronchus, glands, and CNS, and for M5 and CNS. So we will discuss about the action of each of these receptors. So the easiest way to remember is that you should remember that the parasympathetic nervous system is excitatory. It is excitatory in all organs, almost all organs except the heart. Except the heart. So if you remember this sentence, you can remember the actions of the acetylcholine in almost all organs. So in all organs, almost all organs except the heart, the parasympathetic nervous system is excitatory, whereas in case of adrenergic nervous system, it has relaxing properties in almost all organs except the heart. So keep this concept in mind if you want to discuss the muscarinic actions of the acetylcholine. So we'll discuss about the muscarinic action first. So we should take each and every organ first. So first we shall see the action at the heart, action of the parasympathetic nervous system on the heart. So you should see one point that so this is the heart. So we have discussed that the parasympathetic nervous system has got an inhibitory effect on the heart. In all other organs, it has got an excitatory effect. So what is inhibitory effect? Which receptor is present in the heart? We have discussed that M2 receptor is present in the heart. M2 receptor is present in the heart. So what are the actions in the heart? It produces a negative chronotropic. That means it decreases. Chronotropic means, negative chronotropic means it is decreasing the heart rate. Decreases the heart rate means it produces bradycardia. It can produce bradycardia. Not essentially, and overall it decreases the heart rate, and it will produce a negative dromotropic effect. Dromotropic means decreased conduction effect. So the cholinergic system overall, it has an inhibitory effect on the heart. It decreases the heart rate. So you should see that the cholinergic system inhibits heart. It has an inhibitory effect on the heart because it is decreasing the heart rate and it has decreased the contraction effect on the heart. So in all other organs, it has got an excitatory effect. We will discuss the action in other organs. So first, I should see the eye. So in the eye, what it causes? It causes contraction of the. It is stimulating the sphincter pupillae. So thus it causes meiosis. So it causes pupillary constriction. So it is stimulating the sphincter pupillae and causes pupillary constriction. So which receptor is present in the eye? We have discussed that the M3 receptor is present in the eye. So in this section we have discussed that M3 receptor is present in the eye. So M3 is present in the eye. So it produces pupillary constriction. So we have said that in the heart, the cholinergics is having an inhibitory effect in the sense that it decreases the heart rate. So if you are using anticholinergics, what happens to the heart rate? Heart rate will increase. So here also in the eye, if you are using anticholinergics, the pupils will dilate. So what is the effect of cholinergics in the eye? It will cause pupillary constriction in the eye. So if you use cholinergic drugs in the eyes, typically it will cause constriction of the pupil. So that is the effect on the eye. Now we'll see the effect on the glands. So we have said that in all organs except the heart, it will have an excitatory effect. So what happens in the glands? Which are the glands? You know the sweat glands, salivary glands, and lacrimatory glands. In all these glands, the secretion will increase. So the secretion will increase in all these glands. It increases the glandular secretions, increase secretion. Now we have discussed in the glands which receptor is present. In the glands also we have discussed that. So see this one, we have discussed that in the glands also the M3 receptor is present. So which receptor is present? M3. So and we will see the effect on urinary bladder. So we have discussed that in all the organs except in the heart, it has got an excitatory effect. So which receptor is present in the bladder? We have discussed here that M3 receptor is present in the bladder. So receptor which is present in the bladder is M3. So what happens to the bladder? It here you are having a detrusor muscle. So it causes contraction of detrusor muscle. Detrusor, and it relaxes the trigone or the sphincter of the urinary bladder. So contraction of the detrusor muscle and relaxation of the sphincter will cause increased maturation. So it is helping in increase maturation. So it will cause increased maturation. So if you are using anticholinergic drugs, what happens? There will be urinary retention. So anticholinergics will be causing urinary retention. So how can you use cholinergics to the bladder? Cholinergics will be causing increased maturation. So you can use cholinergic drugs for patients presenting with urinary retention. So to treat urinary retention, we can use cholinergic drugs because cholinergics acts on the bladder and increases the maturation by causing contraction of the detrusor and relaxation of the sphincter. So that is the application. Now you see the gastrointestinal tract. So if you see the earlier section, we have said that M1 receptor is present in the GIT, and moreover GIT also contains M3 receptor. So both M1 and M3 are present in the M1 and M3 are present in the GIT. So M1 is present through the M1 it increases the HCl secretion. So M1 acting through the M1 it increases the HCl secretion because increased cholinergic activity in the GIT via the M1 receptors will causing increased HCl secretion can lead to peptic ulcer disease. So if you are using so what is the application here? You can use anticholinergics to treat peptic ulcer also. So via the M3 what happens? M3 is stimulating the smooth muscles. So it will cause the peristalsis of GIT and relaxation of the sphincter. So what is the application here? So as it causes peristalsis of the GIT and relaxation of the sphincter, we can use anticholinergic drugs to reduce the intestinal colic. So for the treatment of intestinal colic as antispasmodic, we can use anticholinergic drugs. Just because the cholinergics are causing increased peristalsis of the GIT and relaxation of sphincter. So what are the two actions of the cholinergic system on the gastrointestinal tract? Acting via the M1 receptor increases the HCl secretion. So cholinergic drugs can cause peptic ulcer disease acting via the M1 receptor. So in this way also you can use anticholinergic drugs to treat peptic ulcer disease. So acting via M3 it is causing increased spasm of the smooth muscles or peristalsis of the GIT. So what is the application here? You can use anticholinergics to relieve spasm of the GIT or to treat the intestinal colic. Now what is the action in the bronchus? So we have discussed in all organs except the heart it is excitatory. So in the bronchus also it will cause bronchial smooth muscle contraction. It is causing contraction. So the receptor which is present in the bronchus is also M3. So if you are using anticholinergics here, what is the effect? We have discussed that acting via M3, the cholinergic system will cause bronchoconstriction. So if you are using anticholinergics, there will be bronchodilation. So we can use anticholinergics to treat bronchospasm, bronchoconstriction. Okay. And we will discuss about the anticholinergic later. Now, in what is the effect on blood vessels? We have not discussed it. Okay. So in blood vessels, what happens is that if this is a blood vessel, it is acting via the endothelium of the blood vessels. So these are N3 receptors which are present in the endothelium of blood vessels. When these receptors are stimulated, it causes the release of a nitric oxide, and nitric oxide will be causing vasodilation. So, but if the endothelium of the blood vessel is damaged, acting via the M3 receptors, it can cause vascular smooth muscle contraction leading to vasoconstriction. However, overall it will cause vasodilatation. So what will be the effect in male sex organs? Male sex organs. So we have discussed that cholinergics is causing vasodilatation. So due to this vasodilatation, it is responsible for erection of the male or sex organ. So erection of penis. Okay. So that is the overall effect in all the organs. Sorry, I missed out one point here. We should also discuss about the nicotinic receptors. We have discussed that it is of two types, NM receptors and NN receptors. NM receptor, NM is present in neuromuscular junction. So, in acting via the NM receptors, acetylcholine, it causes skeletal muscle contraction. So, it will cause skeletal muscle contraction. NN is present in the both sympathetic and parasympathetic ganglia. Sympathetic and parasympathetic ganglia. So acetylcholine will stimulate both sympathetic and parasympathetic ganglia. So via the stimulation of NN receptor. So that is about the nicotinic receptors. Now we'll go into the cholinergic drugs. So which are the cholinergic drugs? So cholinergic drugs are those drugs which are producing cholinergic effects. Okay, acting via they can act directly on the receptors, or they can indirectly increase the level of acetylcholine by inhibiting its metabolism. Okay, that are the two ways in which the cholinergic drugs can act. So it can be divided into directly acting drugs. So what this directly acting drugs will do? So like the acetylcholine, like the cholinergic neurotransmitter acetylcholine, it will act directly on the receptor, cholinergic receptor, and produce cholinergic effect. So that is why it is known as directly acting cholinergic drug. So or it can be an indirectly acting cholinergic drugs. So what is the indirect action? So we have discussed that in this region the acetylcholine is being broken down into choline and acetate by an acetylcholine esterase enzyme. So if you are inhibiting the acetylcholine esterase enzyme, the acetylcholine will not be broken down into choline and acetate. So if this happens, the level of acetylcholine here will be increased, and it will act more of acetylcholine will be acting on the receptors. There will be increased cholinergic activity. So we can also use acetylcholine esterase inhibitors to produce cholinergic effect. So cholinergic drugs can be indirectly acting in the sense that it is inhibiting which enzyme? Acetylcholine esterase enzyme. So directly acting drugs are either acetylcholine, it can be pilocarpine, bethanicol, bethanicol, sorry, methacholine, carbachol. So these are the directly acting drugs. Directly acting means these are directly stimulating the cholinergic receptors and producing cholinergic effects. So we have discussed about the cholinergic effects on different organs. Okay, so acetylcholine, regarding acetylcholine, it is not used clinically because it is metabolized very quickly by the cholinesterases in the plasma and is not effective even by the IV route. So it is not used clinically. And regarding the pilocarpine, so how can you remember the main use of the pilocarpine? P for pupil. So P for pupil. So pilocarpine will be producing pupillary constriction. We have discussed the effect of the cholinergic system on the pupils. It will be causing pupillary constriction. So pilocarpine, by causing pupillary constriction, it is useful in glaucoma treatment. So it is used in glaucoma. So but it has got a disadvantage. The disadvantage is that it is very short acting. So because of which, if you are using 1 or 2 doses of pilocarpine, the intraocular tension may increase. So pilocarpine for pupillary constriction, and it is thus used in glaucoma treatment. So what is the use of bethanicol? Bethanicol is B for bladder. Okay, B for bladder. So it is used for its action on urinary bladder. It has no nicotinic activity. So bethanicol has got no nicotinic activity. So it is useful because of its action on bladder. So we have seen that the cholinergics will be causing detrusor stimulation, relaxation of the sphincter. So it will cause increased urination. So it is useful in urinary retention, for the treatment of urinary retention. So bethanicol for bladder. So what is methacholine? So methacholine has got maximum activity in myocardium. So M for myocardium. So what is its use? It is used inhalationally for the diagnosis of bronchial hyperreactivity in patients who do not have clinically apparent asthma. So it is used for the diagnosis of asthma. So that test is known as methacholine challenge test. Methacholine challenge test. So, and regarding the carbachol, it has got nicotinic and also muscarinic effect. Okay, and pilocarpine as well as cevimeline are two drugs which can be used to treat dry mouth, treatment of dry mouth. So why? The cholinergic drugs are having an increased secretory activity in the glands. It will increase the salivation, so it is used for the treatment of dry mouth. So these are the drugs which are used for treatment of dry mouth because of increased secretion of the saliva. So now we will discuss about the indirectly acting cholinergic. So these are the drugs which inhibits acetylcholinesterase enzyme, and in that way it increases availability and prolonging the action of the acetylcholine. So this can again be divided into reversible ones and irreversible drugs. So reversible and irreversible. So the reversible drugs can again be divided into lipid soluble ones and water soluble. So which are the lipid soluble ones? So lipid soluble ones are physostigmine, tacrine, donepezil, rivastigmine and galantamine. So what about this physostigmine? A few words about the physostigmine. It is a naturally occurring tertiary amine and it is lipid soluble. It is naturally occurring tertiary amine. So what is the use of this physostigmine? Being a lipid soluble drug, because it is lipid soluble, it can be given orally. It is easily absorbed and okay. So it can be given orally. So because it is lipid soluble, it can cross the blood-brain barrier and also the corneal membrane. So as it crosses the corneal membrane, so it can produce effect on the eye also. So what is the main use of this physostigmine? The main use is it can be used as a miotic in glaucoma treatment. And it is also the specific antidote for atropine poisoning. So atropine poisoning. So atropine as an anticholinergic. So as a specific antidote for atropine poisoning, you can use the physostigmine. So that is about the physostigmine. So all other drugs, that is tacrine, donepezil, rivastigmine, galantamine. These four drugs are also lipid soluble drugs, and the peculiarity of these drugs are it is used in the treatment of Alzheimer's disease. So it is used in the treatment of Alzheimer's disease. So in Alzheimer's disease, there is a deficiency of acetylcholine in the brain. So to tackle that, we are using cholinergic drugs. So why these drugs are used? These drugs are lipid soluble, and because these drugs are lipid soluble, they will cross the blood-brain barrier and reaches the brain and produces the effect. Because in Alzheimer's, there is a deficiency of the acetylcholine in the brain. These drugs will tackle that and is used for the treatment of Alzheimer's disease. Among this, tacrine was the drug of choice for Alzheimer's disease, but it has, because of its several limitations, these drugs, donepezil, rivastigmine and galantamine, these are now the preferred drugs. The tacrine is not preferred nowadays. It used to be the drug of choice, but nowadays this is not preferred because of its hepatotoxicity and diarrhea and frequent dosing. So all the three drugs, donepezil, rivastigmine and galantamine, these are the preferred drugs. Among this, rivastigmine has been approved for the treatment of dementia in Alzheimer's as well as Parkinson's disease. Okay. So that is about the lipid soluble ones. Now we'll discuss the water soluble drugs. So which are the water soluble drugs? This include the neostigmine, then pyridostigmine, and we have got the edrophonium. So neostigmine, that is an important drug, and this is having an effect by inhibiting the acetylcholine esterase enzyme. It increases level of acetylcholine, and besides that, it is also having an agonistic effect on NM receptor. So NM receptor agonistic activity is also present. So, and because of which it is stimulating the nicotinic NM receptor, it will produce skeletal muscle contraction. So it can be used in two major indications here. So which are the two major uses of the neostigmine? Because of its action on the nicotinic receptor, it is used in cobra bite. So in cobra bite, there is a muscle paralysis. To tackle that, we are using neostigmine, as a neostigmine is having an effect on NM receptor. So while using neostigmine in cobra bite, to avoid the muscarinic effect, we know that neostigmine produces both muscarinic and nicotinic effect. So in cobra bite, we are using neostigmine because of its nicotinic effect. So to counter the muscarinic effect due to neostigmine, we have to use an anti-muscarinic drug along with the neostigmine in cobra bite. So while using neostigmine in cobra bite, we have to use neostigmine with atropine, which is an anti-muscarinic drug. So atropine has to be used with neostigmine in cobra bite. So which is the other use of neostigmine? Because of its NM receptor activity, it can be used to for the reversal of non-depolarizing skeletal muscle relaxants. So after the usage of a non-depolarizing skeletal muscle relaxants, to reverse the effect of this, we can use neostigmine. So another disease in which it is used, that this neostigmine is used, is myasthenia gravis. Myasthenia, sorry, third one, myasthenia gravis. So in myasthenia gravis also we are using neostigmine to increase the skeletal muscle contraction. So in myasthenia gravis also, if we are using neostigmine, we have to use it along with atropine to decrease the muscarinic effect of the drug. So the three main indications are myasthenia gravis, cobra bite, reversal of non-depolarizing skeletal muscle relaxants. And the muscarinic effect of neostigmine can be used in two conditions. So two conditions where it is used is, one is because of its muscarinic effect, neostigmine can be used in postoperative paralytic ileus and postoperative urinary retention. Postoperative urinary retention and paralytic ileus. So in these two conditions, we can use the neostigmine. So because neostigmine is increasing the level of acetylcholine by reducing its breakdown by the cholinesterase enzyme. In that way, it increases the level of acetylcholine, and acetylcholine will be acting on the muscarinic receptors. So action via the M3 receptors in the GIT and the bladder will produce more of micturition and mode of CIT, smooth muscle contraction. So because of these effects, it can be used in postoperative paralytic ileus and postoperative urinary retention. To treat these conditions, we can use neostigmine. So uses of neostigmine are, because of its nicotinic effect, is used in myasthenia gravis treatment of cobra bite, and for the reversal of non-depolarizing skeletal muscle relaxation. And because of its muscarinic effect, is used in postoperative paralytic ileus and postoperative urinary retention. And about the pyridostigmine, it is so, and the pyridostigmine is that the difference on the neostigmine is that it is longer acting than neostigmine, and it can also be used for all the indications for which neostigmine was used. So for all the above condition, we can also use pyridostigmine. And about the edrophonium, it is a short acting synthetic anticholinesterase drug, and it is useful for the diagnosis. The important use of hydrophonium is it is used in tensilon test for the diagnosis of tensilon test is used for the diagnosis of myasthenia gravis. Myasthenia gravis. So how this test is done is that we are injecting 1 to 2 milligram IV dose of hydropronium into the patients. If it is improving the skeletal muscle activity, and if the weakness is due to myasthenia gravis, if the weakness is due to myasthenia gravis, by the injection of these drugs, the condition of the patient will improve. That is, the skeletal muscle activity will be improving with the injection of this drug if the patient is suffering from myasthenia gravis. So if the patient is not suffering from myasthenia gravis, but the patient is suffering from cholinergic crisis, the injection of this drug will not have any effect on the patient. It will worsen the condition of the patient. So if you are seeing that the patient's condition is improving with the injection of hydrophonium, you can say that the patient is suffering from myasthenia gravis. If the patient's condition is worsening after the injection of this drug, the patient is not suffering from myasthenia gravis, he is having cholinergic crisis. So in that way, we can diagnose myasthenia gravis. So it is used in tensilon test for the diagnosis of myasthenia gravis. That is about the hydrophonium. So I'll be discussing the irreversible cholinesterase inhibitors later. So here we try to say the uses of the cholinergic drugs. So there are muscarinic uses and also nicotinic uses. So if you remember the uses, you can say one by one. So in the eye, for example, in glaucoma, which drugs were used? In glaucoma, which drugs were used? We have used pilocarpine. Okay, we also use physostigmine. And one more drug is an irreversible cholinesterase inhibitor. We have not discussed it. The only irreversible cholinesterase inhibitor which is used in therapeutic practice is the ecothiopate. These are the cholinergic drugs used in treatment of glaucoma. And besides glaucoma, we have discussed the Alzheimer's disease. Okay, Alzheimer's disease, which drugs were used? We have used Tacrin. Was the drug of choice? Nowadays, not frequently used because of its hepatotoxicity, frequent dosing, and diarrhea. Main drugs we are using now is the donepezil, galantamine, and rivastigmine. So in atropine poisoning, which was the specific antidote? Physostigmine. Okay, atropine or belladonna poisoning, we use which drug? We use physostigmine. And which are the other use? We have discussed the Sjogren syndrome. So to treat the dry mouth, here we are using pilocarpine and cevimeline. And for the treatment of post-operative conditions like post-operative paralytic ileus, to treat this condition, we can use which two drugs? We can use pethanichol, which is a directly acting one. B for bladder, we have discussed it earlier, and one cholinesterase inhibitor which is used in postoperative paralytic ileus is neostigmine. And you can use postoperative urinary retention also. These two drugs can be used again, pethanichol and neostigmine. So, which are the nicotinic uses? So, the nicotinic uses of the cholinergic drugs can be divided into three conditions. First one is reversal of the skeletal muscle relaxants, reversal of muscle relaxants, and the myasthenia gravis, and also cobra bite. So which are the drugs used here in this reversal of skeletal muscle relaxant? Two drugs like is neostigmine and a longer acting one, that is the pyridostigmine. Both of this can be used. So So while using this neostigma in this conditions, we have to use along with it the atropine, because to neostigmin produces muscarinic effect. To reduce the muscarinic effect, we have to use atropine along with the neostigmin while using neostigmin in these conditions, because in these conditions we are not expecting the muscarinic side effects of neostigmin to be produced in the patient. So we should use it along with the atropine. In myasthenia gravis, for the diagnosis, we use tensilon test. In that test, we are using which drug? Edrophonium. And for the treatment, we are using neostigmin and pyridostigmin. So, and in cobra bite also, you are using these two drugs, that is neostigmin and pyridostigmin. So, these are the uses of cholinergic drugs. So, we'll be having a separate section on the organophosphates and the carbamates. Thank you for watching this video. To see more videos from our channel, please subscribe the channel. Thank you.